What's going on, moms, dads, parents, providers? My name is Dr. John Caruso. I am a nervous system focused pediatric prenatal family wellness chiropractor in Katy, Texas. And we're going to go straight into a hot topic that's plaguing health that the medical system has started to use as a diagnosis. And this is what's called dysautonomia. We talk a lot about the vagus nerve. We talk a lot about subluxation or neurostructural shift. We talk a lot about dysautonomia, or the imbalance within our autonomic nervous system. And so dysautonomia is a condition that is wildly overlooked, misunderstood, and poorly cared for within today's traditional medical model. As parents, we all dream of a life where our kids are happy, healthy, and thriving. And for hundreds and also thousands of families today, when this perplexing condition called dysautonomia sets in, their child begins to suffer daily from debilitating issues ranging from mood disorders, gut issues, chronic pain, muscle weakness, and a whole heck of a lot more. Dysautonomia is also a significant underlying factor in things like autism, ADHD, sensory processing disorder, seizures, POTS, PANS, PANDAS, all of which are now seen at significantly higher rates than they were just a few short years ago. While traditional medicine can sometimes offer symptom relief, many parents are wondering if there is something more that can be done to help get to the true root cause and help their child achieve full recovery and optimal outcomes from dysautonomia and all of its related health challenges. In this video, we're going to explain what dysautonomia is, what causes it to develop, what associated symptoms and health challenges come with it, and why it's often overlooked, as well as how neurologically focused chiropractic care may be the missing link to restoring your child's nervous system balance through cutting-edge new techniques and clinical protocols. In my practice, some of the most devastating cases of dysautonomia fall under labels or diagnoses of epilepsy and seizures, autism, long-haul COVID has been a really big one over the past year and a half, 2 years actually. But all of those are a significant underlying causative factor that shifts the nervous system. And really, we're labeling it as an imbalance or dysfunction within our autonomic nervous system. Something is firing and wiring the stress pathways or that fight or flight system to be stuck on, which then wreaks havoc on our gut, our immune system, our ability to focus, our ability to concentrate, and so stinking much more. And so dysautonomia is an absolute breakdown affecting our autonomic nervous system, which, if you've heard me talk, or if you've watched any of these videos, we understand that that is the master control center that is managing nearly every organ and every system within the body, from digestion and the regulation of inflammation to breathing and blood pressure and our heart beating and our lungs breathing. And when not functioning properly, dysautonomia throws off the communication between our brain and between our body, and it manifests in diverse symptoms that differ based on which organs that it impacts. The most common symptoms, such as gut issues, anxiety, heart palpitations, fatigue, are related to the most commonly affected systems, which are the digestive system, the cardiorespiratory system, and the brain. The question that nobody seems to answer when we talk about traditional medical approaches is what really triggers or causes dysautonomia in the first place. Not only do traditional medical doctors and neurologists struggle to properly recognize and effectively treat dysautonomia, they also struggle to explain what's really causing it. Our clinical observations and research review highlight 5 main triggers of dysautonomia. The first is prenatal or maternal distress, such as high risk or high anxiety pregnancy, because this exposes the developing fetal nervous system to excessive stress hormones in utero and may lead to underdevelopment of the vagus nerve and the parasympathetic nervous system. The second is birth interventions, like forceps, vacuum extractions, and cesarean deliveries that lead to physical injury and trauma that then create and lead to biomechanical misalignments, subluxations, neurostructural shifting within the upper neck and our upper back area, which then tends to negatively impact the function of our vagus nerve and the parasympathetic nervous system once again. The third is vagus nerve injury, damage, and dysfunction, because those are without a doubt the leading cause of dysautonomia. The fourth is altered development and missed milestones, because this leaves the brain and nervous system underdeveloped, off track, and less resilient and adaptable later in life. The fifth is recurrent infections, so ongoing gut issues, chronic inflammation, and the overuse of antibiotics and other medications throughout a child's life, which then creates chronic sensory challenges and anxiety in our kids that triggers a continual stress response and excessive stress hormones. Over time, this cascades into a vicious cycle where the overdriven nervous system fails to regulate itself properly. And this is what's called dysautonomia. Once dysautonomia sets in, the patient, your child, struggles to properly maintain homeostasis, which is our body's ability to keep things normal, the ability to regulate their nervous system and adapt to even regular daily stressors and routines. It's daunting. All of this information is hard and it's heavy, and there is hope because there is the ability to track dysautonomia and neurological changes within the toughest cases utilizing neurological insight scanning technology. And while traditional medicine continues to lag behind in their understanding and proper care for dysautonomia, there is an entire network of specialists that are called neurologically focused chiropractors who have a deep understanding of dysautonomia and can provide a drug-free clinical approach that addresses the root cause of dysautonomia head on. This unique and cutting-edge approach begins first with a deep dive into your patient, your child, your family's case history to find out if any of those 5 perfect storm risk factors of dysautonomia has occurred. From there, we then get to the best and really most exciting part of our job, which is the insight neurological scans and heart rate variability technology. Because these scans can find and detect the presence of neurological dysfunction and dysautonomia at an incredibly advanced and in-depth level, going far beyond what traditional medical testing like blood work and MRIs or even an EEG may reveal. I want to share that with you real quick. So we're going to slide over to my view to show you exactly what that looks like. So the most important element to these incredible scans is what's called heart rate variability. And heart rate variability is the gold standard for finding dysautonomia. And then being able to track and measure positive improvements in autonomic nervous system balance and function as adjustments begin and care progresses. The doctors that we have within the PX Docs network are trained specifically in caring for dysautonomia without drugs, without surgery. And they know how to use specialized techniques and clinical protocols to seek to restore balance and function to the autonomic nervous system, activate the vagus nerve, and over time, patients, children, families, kids regain the balance within the neurological function and incredible quality of life that comes with it. So this is what heart rate variability looks like. We have our balance between sympathetic and parasympathetic. For simplicity's sake, our sympathetic side of the nervous system is our gas pedal. Parasympathetic is our brake pedal. And so the other thing that this looks at outside of balance is what you're seeing from top to bottom, and that's the autonomic activity index. So the way that I describe this is how full or how empty is our gas tank. Because if our body and our nervous system is stuck on the gas pedal, we're going to start pulling from our body's reserves, and ultimately the stress bucket's going to get fuller and fuller and fuller. So what you can see with this one is that this scan, this child, this person's nervous system is very significantly stuck into fight or flight, stressed out mode, and it's been there for a while because the reserves or our gas tank is getting more empty. And so this is a pretty significant pattern of stress stuck onto the nervous system, and that dysautonomia process has really set in. The biggest thing that heart rate variability looks at is what's called vagal tone. Heart rate variability is a direct measure of vagal tone, or the tone or the function of our vagus nerve, because that controls so many key functions, including heart rate, our digestion, our lungs breathing, food moving through, as well as a big key player to this parasympathetic side of our nervous system. And so a brain that's stuck into stress is not necessarily going to grow. It's not necessarily going to function or focus, let alone do the normal day-to-day functions that our bodies are programmed to be able to do. So to be able to learn more about dysautonomia and how neurologically focused chiropractic care can be the missing link to drug-free relief and neurological restoration, comment below. Send us a DM or even see the link in our bio to be able to learn more about what we do within our office. We can't wait to hear with you because we're always here to help.